Hello and welcome to the second installment in this video series. If you haven't had a chance to catch the first video, I encourage you to do that as it contains some foundational information that I will be building on in this next segment. I've included a handout for each video that you can complete as you are following along if you would like. The focus of this segment is on pain. Since the subject matter is extremely vast and complex, I will be summarizing a few key areas for consideration. I chose this topic because most people that come to see me are in some sort of pain and they're desperate for relief. Here are some pain statistics from the National Institute of Health. Pain affects more Americans than diabetes, heart disease, and cancer combined. It is cited as the most common reason Americans access the healthcare system. It is a leading cause of disability and a major contributor to healthcare costs. Because there is such a diversity of pain conditions, it requires a diversity of research methods and treatment approaches. Some causes of pain: inflammation, stress, injury, sugar intake, nutrient deficiency, lack of sleep, allergies, food sensitivities, misalignment, dehydration, hormone imbalance, toxins in the food, water, and the environment, and electromagnetic chaos. Some examples of nutrient deficiency and pain include statin cholesterol drugs, which can deplete CoQ10 and vitamin D, which then results in muscle pain, leg cramps, and back spasms. Antibiotics, oral contraceptives, HRT and thyroid medications can deplete magnesium and calcium, which can lead to muscle pain. Anxiety medications can deplete melatonin, which is a natural pain reliever that reduces inflammation. About 15% of the population suffers from migraine headaches. Some possible triggers are stress, tension, and anxiety, magnesium deficiency, insufficient food or sleep, intense sensory stimuli, fluctuations in estrogen, and foods such as chocolate, aged cheeses, wine, beer, caffeine, and MSG. Food can play a major role in pain management. Because of the strong correlation between inflammation and pain, it's important to avoid foods that are inflammatory. This would include your omega-6 fatty acids, sugar, refined carbohydrates, and aspartame. And you want to increase your anti-inflammatory foods: walnuts, green tea, berries, garlic. Food sensitivities can also trigger inflammation and lead to pain. Some of the common foods in this category would be gluten, dairy, soy, and nightshade vegetables, which are tomato, eggplant, peppers, and potato. Some people have seen a correlation between eating nightshade vegetables and arthritis. An elimination diet is the best way to see if any of these foods may be a factor for you. So what treatment options are there when it comes to pain? There are two categories of pain medications. First, there are the opiate analgesics, which are prescription medications and include Vicodin, morphine, Oxycontin, and Percocet. They are highly addictive and therefore should be limited to short-term use. The second category are NSAIDs. These are the non-steroidal anti-inflammatory drugs, and they include ibuprofen, aspirin, and naproxen, which is Advil, Aleve, and Motrin. They are non-addictive, but they deplete vitamin C, folic acid, iron, and zinc. They can be harmful to your stomach, resulting in bleeding or ulcers depending on extended use, and they can also harm your kidneys and liver. They are responsible for 30,000 deaths a year. Some statistics from the White House Office of National Drug Control Policy regarding prescription drug overdose in the United States. Drug overdose was the leading cause of injury death in 2012. Among people aged 25 to 64, drug overdose caused more deaths than motor vehicle crashes. The death rate from drug overdose has more than doubled from 1999 through 2013. In 2013, 81% of drug overdose deaths were unintentional, and almost 52% of those were related to pharmaceuticals. 71% of the unintentional pharmaceutical deaths involved opioid analgesics, which are your prescription painkillers, and 30.6% involved benzodiazepines. Often a combination of these two medications were implicated. If you are taking medications, though, it is important that you consult your doctor before stopping them or decreasing them, as there could be serious side effects. There are safer alternatives for pain relief. Since the earliest recorded history, herbs have been used to alleviate pain and enhance healing. Although there are safety concerns and interaction considerations with some herbs, overall they are far safer than pharmaceutical medications. The herbs that work best for pain depend on multiple factors, including the source of pain, the individual's inherent predisposition, their current health status, and their state of mind. I have been using herbs for over 35 years, and I have countless stories with amazing results. Here are just a few. Cayenne. Cayenne increases circulation, and it removes stagnant blood and blocks pain signals. It accentuates the therapeutic action of other herbs when used in combination. Ginkgo is 4 times more effective when combined with cayenne, and according to one study, the antioxidants in green tea are 100 times more effective when combined with cayenne. Several of my clients that suffered with chronic migraines for years found relief with a brain formula that included cayenne as a key ingredient. Another client had severe back pain for over a month and found relief almost immediately when she used a nerve formula that also included cayenne. But some of the most amazing transformations that I've seen over the years have been with a combination of herbs that provide support for building strong bones and ligaments and muscles. These herbs reduce inflammation and pain in the joints, and they provide musculoskeletal rehabilitation after injury. A few of them are lungwort, which contains allantoin, which is an anti-inflammatory compound that's known for its wound healing properties. Plantain, skullcap, and wormwood all contain silicon, which promotes firmness and strength in the tissues and works with calcium to restore bones. This combination is one of my favorites because I've had multiple whiplash injuries in the past, and I've used these tissue herbs internally and externally with immediate results. One client of mine had a very painful upper back, neck, and head pain that lasted all weekend. She was not even able to rotate her neck at all. When I gave her the herbal combination that was made for tissue, she had relief and movement within an hour after taking it. Another client came to me because his big toe was almost completely numb for over 4 months. And after using the tissue herbs externally as an ointment, the numbness was completely gone after 2 applications, and it has stayed that way for 4 years now. The results have been very positive from athletes and multiple clients with back injuries, leg cramps, and headaches. I use it myself before and after I go on a long hike, and it helps to prevent pain and stiffness and injury. Ginger is another herb that I like to keep on hand. It has anti-inflammatory and analgesic properties. It reduces chronic inflammation, pain, and migraines. It's used to ease muscle pain, back pain, bursitis, and menstrual pain. I have recommended ginger tincture to at least a dozen people over the last 10 years for joint pain and headache, with wonderful success. Turmeric has been used as a medicinal herb for thousands of years. Much of its benefits are attributed to curcumin, one of its key components. In a clinical study, curcumin was more effective than a leading anti-inflammatory drug for arthritic pain. After 8 weeks, participants taking the curcumin had a 60% reduction in pain scores. Feverfew is used as a preventative treatment for migraine. A number of people have reported that after taking it, their migraines became less frequent, and in a few cases, they stopped altogether. Butterbur is used in Germany as a prescription remedy for migraines. It has been shown to be as effective as many prescription medications in preventing migraine, with far fewer side effects. Willow bark contains salicin, which the body converts into salicylic acid, the chemical precursor to aspirin. In studies, willow bark helped relieve lower back pain and osteoarthritis pain. Wild lettuce has a long history of use as a tranquilizer and painkiller. It was used during the 19th century as a substitute for opium. Peppermint stimulates blood flow. It relaxes migraines and tension headaches. It can be taken internally as a tea or as an essential oil applied to the temples and pulse points, or inhaled. Some additional suggestions that you can do for identifying and alleviating pain. Keeping a daily journal of foods and activities, interactions with others, your state of mind, and any of the above triggers can assist in tracking the cause of your pain. Note if the pain is recurring and regular, such as a particular time of the day or days of the month. Also note where you feel the pain in your body. Relaxation techniques such as yoga and Pilates have shown to increase circulation, relieve migraine pain, and reduce chronic back pain. Chiropractic and massage therapy can restore mobility, alleviate pain, and promote tissue healing. Results from a number of studies suggest that acupuncture may help ease chronic low back pain, neck pain, osteoarthritis, and knee pain. It can also reduce the frequency of tension headaches and prevent migraines. Getting sufficient sleep can help with pain. Melatonin, a hormone that is released during sleep, is a natural pain reliever that reduces inflammation and supports the release of endorphins, which are your body's natural painkillers. Hydrotherapy. Add Epsom salts to a hot bath to reduce stress, muscle pain, and inflammation. Alternating hot and cold compresses also stimulates blood flow to an injured or painful area. So I look forward to your feedback. Please let me know what information was helpful to you on this video and what you would like to know more about. You can post your comments and questions below. On the next video, I will be sharing some insights on emotional wellness and brain health and its effect on our physical health and our quality of life. Till then, live with vitality and purpose. See you soon.